So good evening everyone. We're going to study about the most important topic, the most commonly asked question in the MUHS perspective from the surgery, that is shock. First we'll start with a definition. Shock is a life-threatening clinical condition characterized by inadequate tissue perfusion resulting in cellular hypoxia and oxygen dysfunction due to failure of circulatory system. Classification of shock. So, shock can be classified into four types. That's hypovolemic shock, cardiogenic shock, distributive shock, or obstructive shock. Again, distributive shock is again subdivided into three types. That is septic shock, anaphylactic shock, or neurogenic shock. What is hypovolemic shock? Hypovolemic shock occurs due to loss of vascular volume. Causes are hemorrhage, that's trauma, or GI bleeding, burns, severe dehydration, which occurs due to vomiting or diarrhea. Cardiogenic shock. Cardiogenic shock due to pump failure of the heart. Cardio, that means heart. So there's failure, pump failure, sorry, due to pump failure of the heart. Pump Heart fails to pump the blood, right? So causes are MI, severe heart failure, erythemas, or cardiomyopathies. So third one is the distributive shock. Distributive shock is a type in which there is a severe peripheral vasodilatation leading to relative hypovolemia. So in this there is a peripheral vasodilatation that leads to relative hypovolemia, decreased systemic vascular resistance, and inadequate tissue perfusion despite the normal or increased cardiac output. So we'll see what is severe peripheral vasodilatation. So vasodilatation means there's a widening of the blood vessels in the body that leads to the fall in the BP. So severe vasodilatation means marked widening of small blood vessels, that is arterioles in the body, leading to sudden fall in the BP. So subtypes are septic shock, in which there is severe occurs due to severe infection that is because of vasodilatation or capillary leak. Anaphylactic shock. These occurs due to the allergic reactions. Allergies can be due to the medication, the drugs, the kind of foods, and the insect bites or the insect stings. The insect. Yeah. So third is the neurogenic shock, spinal cord injury or head injury. Occurs due to neuro spinal cord injury or head injury. So we'll come to the fourth type of the shock, that's obstructive shock. This occurs due to mechanical obstruction to the blood flow. And what are the causes? The causes are pulmonary embolism. Pulmonary embolism, in which there is a blockage in the lung artery, usually caused by blood clots. Cardiac tamponade, life-threatening condition in which fluid builds up in a sac around the heart. And tension pneumothorax, in which there is air enters the chest cavity. Stages of shock. So we have done with the types of shock. We'll come to the stages of shock. So compensate shock. This is the early shock, early phase of shock, in which there is a tachycardia, normal BP, and cold calm skin. Second is the progressive. So in progressive, there's a hypotension, oliguria, that's reduced urine output, altered synoserum, that is patient is confused, disoriented, and less aware, decreased awareness. Irreversible shock, as you can appreciate by the word irreversible. So there's a multi-organ failure, severe metabolic acidosis, and despite the treatment, the patient dies. So you can appreciate the heart here. Okay, you can appreciate the diagram of the heart. So this is the superior vena cava, right atrium, right ventricle, inferior vena cava. This is the apex of the heart, Okay, just remember this. What are the clinical features of shock? So first is the hypotension. Please excuse me if you can hear some background noise. I'm sorry for that. I'll try to fix this in the next video. So first is the hypotension. Hypo means increased. Okay. So and hypo means decreased. Oh, I'm so sorry. Hypo means decreased and hypo means increased. I'm sorry. So in this there is BP which is less than 90 mmHg. Okay. This occurs due to reduced cardiac output, peripheral vasodilation, and reduced circulatory blood volume. Second is a tachycardia. That's heart rate is more than 100 beats per minute, and this is a compensatory mechanism to maintain cardiac output. And this occurs due to sympathetic nervous system activation and release of catecholamines. Oh, I'm sorry to mention this. I forgot to mention this. The normal BP in the healthy individual is 120 by 80 mmHg. So systolic should be 90 to 120 mmHg and diastolic should be 60 to 80 mmHg. Just remember this, okay? And the normal heart rate should be between 60 to 100 beats per minute. More than 100 beats, that's tachycardia. Second is the cold calm skin, that's seen in hypovolemic shock and cardiogenic shock. And this occurs due to peripheral vasoconstriction or reduced skin perfusion. In this, there's a warm skin in the septic shock. Oliguria, as you have discussed, urine output is decreased in oliguria, that's 0.5 ml per hour. Indicates poor renal perfusion, and this occurs due to reduced renal blood flow. So cyanosis. Cyanosis is the bluish discoloration of nails, lips, and tongues. Indicates severe hypoxia or poor peripheral circulation. And this is the last stage of shock. Okay? Cyanosis is the last stage of shock. So we'll come to the management. We have done with the types, we have done with the clinical features, now we'll come to the management. So management is the airway. So we should ensure the proper airway of the patient. The airway should be cleared. Okay, the sputum should not be accumulated. Second is the suction if needed, and endotracheal intubation if needed. Okay, second is the breathing. So high flow of oxygen should be maintained. Proper well ventilated room. SpO2 should be monitored. Okay, mechanical ventilation if required. Right. So third is the circulation. So blood transfusion if hemorrhagic shock, and monitor BP, pulse, and urine output. So that's it. Thank you so much. And if you need these notes in the PDF format, you can just DM me on Insta as well as on WhatsApp community.